2024. This is the first Working Group 2.2 meeting for the new year. And I'm Brian Morales from the U.S. Department of State and have a few administrative announcements before we get started today. I'm going to start off by speaking about three sectors that we are engaging through the coalition's work. The first sector is civil society. The Global Coalition Civil Society Forum, hosted by the Vienna NGO Committee in collaboration with the New York NGO Committee, will take place on the 1st of February in two sessions, one from 9 to 11 in the morning, the other from 4 to 6 in the afternoon, Central European time. Coalition governments are encouraged to attend and to hear from civil society organizations. Second, we are looking forward to Global Coalition national dialogues between governments and civil society organizations. We are asking countries individually to organize these. The United States will organize ours on the 24th of January, hosted by the White House Office of National Drug Control Policy, open to US civil society organizations. We have shared with civil society organizations the background on the coalition and are inviting them to deliver statements. This session will be recorded and posted on the website. Likewise, we're inviting all of you to host your own meetings with your national civil society organizations to discuss the Global Coalition and synthetic drug threats, and then send the videos or write-ups to us, and we will post those on the website. Finally, the Vienna NGO Committee will collect additional feedback and recommendations from civil society organizations, and we will also make those available to you all on the coalition website. Now, the second sector is the university sector. And I'd like to introduce to you ICU DDR, which is the International Consortium of Universities for Drug Demand Reduction. This is an NGO that was established in 2016 with funding from INL, my office, and has currently 422 universities from around the world that participate. ICU DDR will convene universities to reflect on the challenges of synthetic drugs and to provide us with research, policy ideas, and programming recommendations. The discussion that will ensue will focus on all three working group themes. Even though it's demand reduction focused, it will also be discussing supply reduction and data collection. And the activities it will undertake are three. First, regional focus group virtual meetings in 6 regions: Africa, Asia and the Pacific, Europe, Latin America and the Caribbean, the Middle East, the US and Canada. And they will develop recommendations and prepare reports for governments. This will take place February to March. Then between April and June, ICU DDR will convene again through 6 regional meetings, universities and governments. All of you will be invited to discuss recommendations and incorporate views from all of you, government representatives. And a report will be developed by ICU DDR for the benefit of coalition members. Finally, ICU DDR will conduct an inventory of university initiatives that can support the Global Coalition's work and document those on the website, and that will be during the month of June. The third sector is the private sector. And next month, we will share with you our engagement plan and the recommendations for engaging 6 industries around the coalition themes. Next, I want to share with you a new communication tool that will be developed for the coalition website and become live next month. I previewed it at the last session. It is similar to LinkedIn, Facebook, or YouTube, where you can post your own content or react to other people's content with comments, questions, and it's very much a social media tool. In the coming weeks, you will receive an email to create an account, because we require account activation so that when you post, you are posting under your name the content that you wish to share. We welcome you to share news, experiences, and most importantly, your recommendations for the coalition moving forward. This will be a very important tool to capture those recommendations and then document those and help us collect all of that data. Finally, I want to share with you a bit of the calendar over the coming months so that we're all up to date in terms of where the coalition is going. So I'd like to share with you what we are calling an initiatives menu, which details or documents programs, actions, policies that we can all take individually or collectively. Between the months of December and January, we asked international organizations to share with us initiatives that they were either working on previously or which they recommend to start. And we have received over 100 initiatives from 11 international organizations. They are quite numerous. We're going through all of them. So during the months of January and February, our team in INL will be posting on our website the menu of initiatives that the international organizations have shared with us on the coalition website. And we think this is a wonderful catalog that shows a lot of the work that has taken place or can take place under the coalition. What does this menu look like? Let me give you an example of what one of these projects will look like. First, we will have the project or initiative title. We'll have a brief description. We will have a background that will include documents or videos of that initiative. We will have accomplishments to date if it is an existing initiative. We will also have a sort of itemized list of program activities that will take place under this initiative. Then we will have outcomes at the global and national level. We will include the names of any countries that are currently participating, and we will also have a point of contact who you can connect with if you would like to participate in this initiative. Now, during the month of February, we will continue posting initiatives on the coalition website. And then between February and March, we will ask all of you coalition participants to begin identifying which of these initiatives, which activity you would like to participate in, and express interest directly to those individuals that are leading these initiatives. So not to us in INL, but to the organizations that are running these activities. Then during March, I know many of you will be participating at the Commission on Narcotic Drugs in Vienna. So we look forward to engaging at that time with all of you and having a discussion, further discussion on these initiatives. Then April to July, we begin the implementation of the initiatives, and it will only be the beginning. We hope and expect that they will continue for several years to come. Finally, I want to conclude by sharing with you the process for developing recommendations for the coalition as well. Our team has been reviewing the topics from the monthly coalition meetings, as well as those topics for the upcoming 2 months, January and February. And we are creating a draft list of recommendations for everyone to react to. During the month of February, we will be sharing that draft list of recommendations with co-chairs, and it will be posted on the website for consideration for you to consult within your governments and to help us modify, change, and expand this list. Between February, on March 6th and 7th, we will have our working group meetings where the sub-working group co-chairs will report to the working group co-chairs the progress that has been made during these months of the coalition, as well as the recommendations that they are formally presenting to the working group co-chairs for consideration. That will be an opportunity for discussion, modification, and inclusion of additional ideas. And then following that, we will be posting these recommendations on the website, but we will continue to welcome further input from participants in terms of the content of these recommendations. And so that is a bit of the process in terms of the recommendations for the coalition. I know that is a lot of information. If you missed this or would like to see this again, we will be posting the content of that I just covered next week as we post the video for these sessions. So with that, I'd like to turn it over to our co-chairs for today's session and looking forward to the presentations. Thank you all so much.
Welcome everyone to our first session for 2024.
And my apologies, can you speak much closer to the device? Thank you so much.
So welcome everyone to our first session for 2024. Shane and I are very excited for our session today. Wastewater is something that we are very passionate about. Our first presenter today is Dr. Ben Tscharke, a Senior Research Fellow from the University of Queensland. We will be commencing with a pre-recording from Ben, and Ben will be joining us later this afternoon with a in-person for Q&A session after our second presentation. So if we can please play Ben's presentation, please.
Hi everybody, my name is Ben Tscharke. I'm a Senior Research Fellow at the University of Queensland, and today I'm going to talk to you a little bit about the National Wastewater Drug Monitoring Program, which is funded by the Australian Criminal Intelligence Commission and also worked on by researchers at the University of Queensland and the University of South Australia. The main premise behind wastewater testing is that anything that you're exposed to, say the intentional ingestion of illicit drugs or prescription drugs, or the unintentional ingestion of biological agents such as COVID-19 virus, goes through the human body and then is eliminated in the urine or feces. Now here we could test the individual's urine to determine the drugs that they've been using, but with wastewater testing we can extend this to whole communities because the urine from individuals are going down the toilet into the sewer network and then arrive at a central place called a wastewater treatment plant. So we can collect samples there and analyse them to determine the drug use of whole communities. While this was very common for COVID-19 during the pandemic, the technique has been applied to illicit drugs for the first study in 2008, so it's been around for a while. And here in Australia, both universities have been working on this since about 2009. One of the main reasons for the establishment of the National Wastewater Drug Monitoring Program was the massive increase in methamphetamine issues in Australia in the years prior to the start of the program, towards the end of 2016. So, for example, purity was increasing massively in the years prior, and at the same time this is reflected in the amount of crystal methamphetamine used by respondents in surveys. This was also at the expense of the powdered form of the drug. Now, over the same time, daily use of methamphetamine was increasing from about 9% of respondents to about 20%. But interestingly, the prevalence was actually decreasing. And I suspect this could be due to the media stigma attached to the use of the drug and possible reluctance to reveal the drug use in surveys. However, on the whole, the traditional measures were showing that high purity methamphetamine was being used in greater proportion of the user group and at an increasing frequency and potentially by fewer people. Now, the interesting thing about the wastewater data is it sort of integrates all of those measures together, all the number of users, how much they use and when they use, and into one measure. So over the same period in the wastewater data, we saw the increase of methamphetamine mass used by about 5-fold. And this was by 2 separate labs and for 2 cities that were 2,000 kilometres apart. The other appeal of wastewater data is that it can be acquired at much higher frequencies than other measures such as surveys, which our national survey is once every 3 years, whereas the wastewater data can be fine-tuned for the application and can be up to daily if needed. So our program was one of the first to start at national scale at a particular country. We're looking at about 55 locations for up to 6 weeks per year, and we've separated our sampling into 2 zones. We cover all states, but within those states we look at the state capitals. This is mainly because of Australia's population distribution, that the state capitals generally have about 65% of the population of the country, as well as some regional towns and cities. So they're the smaller cities outside of the main capitals. And this is really good because some of the surveys and other metrics don't actually capture the regional cities very well, but with our wastewater testing, we can capture them as well. We're looking at about 14 million people, which in Australia is about 50% of the population. So far, we've released 20 public reports, and these are all available on the Australian Criminal Intelligence Commission website. So far, we've tested about 10,000 samples over the 7 years of the project for different illicit drugs, for example, methamphetamine, ecstasy, cocaine, heroin, cannabis, as well as some other drugs with abuse potential, such as fentanyl, oxycodone, nicotine, and alcohol. So as you might have noticed, there's actually quite a lot of data in this data set. But just to give you a very broad overview of some things we can get out of our wastewater testing, I've just got here the national scale of use for alcohol over the whole period. And the patterns we can see are different between the different drugs. So alcohol's been decreasing overall over the last 7 years. MDMA has had some sort of dip and then a peak here just prior to COVID. And after COVID, it really dipped for a long time and has only started just now to be recovering, if you want to call it that. Methamphetamine has a very different trend to both of those, where it's sort of going up and down. But there are some dips that we can sort of associate to times when things were happening. So, for example, this dip was during when our main COVID enforcements were happening back in 2020. And then in 2021, there was a major operation called Operation Ironside, which was an international operation that arrested about 200 people and was between other countries as well. So on a national scale, we can sort of see some sort of impacts happening here and long-term trends. But because we're not the only country that collects this kind of data, we can also look internationally. So there's a consortium in Europe which actually tries to do an annual collection of data across Europe and involves also other countries. So this is mainly Europe, but we can also compare how Australia sits compared to other countries in terms of methamphetamine use. So we're sort of on the top end here, and I've also cut off some of the cities here because it doesn't really fit well on this slide. As well as that, we can actually look at the profile of drugs, how they're different between areas. So here we can look at Oceania, so Australia and also New Zealand. And some areas like South Korea, United States also look like to be more meth dominant with much less amphetamine and cocaine. But then for some of the European countries, they're much less methamphetamine used and much more amphetamine or much more cocaine dominant. So you can also see the patterns in the other stimulants compared to others as well. One interesting thing about wastewater monitoring is that it's very good for testing interventions. So some of these are actually unexpected, such as the COVID-19 pandemic. So here we're looking at meth use during COVID-19 at 4 cities across Australia. And what was interesting to me was that the decrease in methamphetamine during the main COVID lockdown was much smaller in Sydney and Melbourne, which are the larger capital cities, compared to the smaller cities of Darwin and Perth. Now, I suspect this could be because the state borders were shut during that period and crossing them required quarantine. So it's entirely likely that the shipments were still coming into the large ports, but these were not able to be redistributed to the smaller cities. During our monitoring campaign, we've also been able to look at this codeine intervention, which was a health intervention to prevent misuse of codeine products. So codeine was available over the counter. You didn't need a prescription to buy it prior to February 2018. And in the data, you can sort of see this annual use seasonal use because it was in cold and flu tablets. Now, after 2018, they made it prescription only. So this basically decreased 40% of the market overnight. Another interesting trend was in Adelaide for methamphetamine, where we can see distinct decreases in consumption trends around similar times where massive seizures were made at the national border. So, for example, there was 900 kilograms or 1,200 kilograms seized in these 2 events here, and each of those were around 10% of the Australian national use of methamphetamine in each of those seizures. It's also interesting that it shows some of the potential distribution of methamphetamine because Adelaide is actually 800 kilometres from Melbourne and about 2,000 kilometres from Western Australia where those seizures were made. So it also gives an insight into the potential distribution of methamphetamine. There are other applications for wastewater testing. One of the ones we've had some research in is in prisons, where you can look for contraband use of illicit drugs. You can also look for if there's been extra use of pharmaceuticals which haven't been prescribed if you compare to the prescriptions that are supplied within the pharmacy at the prison. You could also look at music festivals or other specific events where new drugs might be taken. Possibly could look at work sites in terms of health and safety. You may not want heavy machinery to be operated when people are under the influence of drugs. However, this may raise some ethics issues around identifying individuals. Globally, there's a push to start an aircraft or airport monitoring wastewater. This is in particular response to COVID to see what variants are around and where the variants might be coming from. Some countries in the world don't have very good monitoring within their country, but you can analyse a flight arriving from a particular country and see if there's any particular variants arriving in there, sort of to trace where COVID's coming from and where it's spreading to. You might also be able to look for manufacturer of different types of drugs. There are other applications for triangulating wastewater data to other data sets. So, for example, as we've shown here, you can compare when police activity or seizures occur and how that impacts the trends in consumption. You can also look at other interventions like health interventions. We can also look into socioeconomics of the regions and try and investigate what drivers might be behind the consumption patterns that we see in particular sites. We can also look at different substance types. So other substances we've measured in our research has been opioids, steroids. There's the option of looking at other biologicals like COVID and other viruses. We looked at prescription drugs, novel psychoactive substances, as well as maybe looking at drug precursors as well. That's all from me. Thanks very much for inviting me to present, and I'm happy to take any questions.
Thank you, Ben, and we'll be taking questions at the end of the session. So this afternoon, you will also be receiving a presentation from Shane and I on wastewater analysis, focused on new insights and informing policy and operations. If we could ask that you could put up our presentation, please, as we have technical issues from our side, please. Many thanks.
Is it showing all right?
It's coming through, thank you. So Sarah, we'll have to get you, unfortunately, to flick. Our systems issues means that we cannot do it from our end. Thank you.
No worries.
So why wastewater analysis? So wastewater provides a measure of actual as opposed to reported or perceived drug consumption and demand. That is the quantity consumed. So wastewater forms part of every major drug conversation in Australia and is essential for informing meaningful harm conversations and risk assessments, as harm is a function of the level of consumption. Sorry, Sarah, can you flick to the next one? Sorry, thank you. No, yeah, before. Thank you. So our National Wastewater Drug Monitoring Program is a regular, flexible and timely data source which lends itself to policy and operational decision making. There are no hidden populations and it is non-intrusive. It provides a unique source of data on regional populations, and the program is highly regarded due to the frequency of sampling, the number of sites, the geographic reach, the extent of the population covered, and the expertise of the universities involved. Next slide, please, Sarah. Thank you. So in addition to reporting the load consumed, the ACIC has always included, where possible, dose figures for the drugs monitored by the program. So we think this is very important when you're dealing with drugs such as fentanyl. So since Report 19, the University of South Australia has determined a reliable dose figure for cannabis, which permits us to compare the use of drugs with the use of other major illicit drugs available dose data. So nicotine and alcohol aside, cannabis is the most consumed drug by a large margin, despite substantial fluctuations. So as can be seen from the figure on the left, cannabis consumption has been at least double the consumption of methamphetamine throughout the time that both substances have been monitored by the program, with consumption of methamphetamine being less variable. So a comparison of the various drugs of concern in Australia, including cannabis, as indicated, is on the left-hand side of the slide. So the figures show the comparison of cannabis, methamphetamine, cocaine, heroin, MDMA, fentanyl, and oxycodone consumption. So consumption of drugs other than cannabis and methamphetamine has also fluctuated throughout the life of the program, albeit within a narrower range. A comparison of drugs other than cannabis is on the right-hand side of the slide, just to make it easier to note the differences in consumption. So next slide, please, Sarah. Thank you. So insights derived from the program have been varied as well. So wastewater data can be diced and sliced in a number of interesting and informative ways. So this figure provides the annual consumption estimates for methamphetamine, cocaine, MDMA and heroin for the first 6 years of our Australian program. So these estimates provide the size of the major illicit drug markets, and they would not have been possible without wastewater analysis. And this is one of the key reasons we established the program. It shows, for example, that in the year to August 2022, an estimated 9 tonnes of meth was consumed, 3.3 tonnes of cocaine, 700 kilos of MDMA, and 1 tonne of heroin. So on the next slide, we have another unique application of our wastewater analysis. So using the estimated consumption weights of the drugs, we've been able to use national median drug price data to estimate the value of the 4 major illicit drug markets. So again, this is another of the reasons we established the program. So we can see from the data that methamphetamine accounts for the majority of the $10 billion we estimate that we were expended on these 4 drugs in Australia in 21-22, which is around 83% of the year 6 value of the program. So when we look at the broader applications of wastewater analysis, our National Wastewater Drug Monitoring Program has never just been about collecting data. Our focus at present is also about defining sources of threat and the changing levels of consumption and understanding these with greater precision as many parts of Australia as possible, particularly away from wastewater treatment plants. We engage with partner law enforcement, policy and health agencies, and sometimes with private sector, to combine data and better understand market demand and supply. And we do this through integrating research and operational activity, merging data with other law enforcement drug data, and integrating wastewater data with health and private sector data. I'll now hand over to Shane to take you through the rest of the presentation.
Thanks, Amber. Next slide, please, Sarah. Oh, we're there already. You're way ahead of me. Thank you. Another key focus of our wastewater program is to drive and inform policy change at a government level. This slide represents a case study of work by the ACIC, 2 partner universities and law enforcement partners in a regional town of 1 jurisdiction in Australia. The aim of the initiative was to marry wastewater analysis with an illicit drug survey and engagement with local response agencies. The context of the work was a need to pay increased attention to rural and regional drug consumption, related harms, and responses. So what occurred is that at the one time, it was arranged that we would triangulate operational activity by police in the local area with a purpose-built drug survey and detailed wastewater data over a 90-day period on the level of consumption in a regional city. The other thing that was done was to assess the ease of access to drug treatment services and broader services in the area and feed all the outcomes into policy and practice recommendations to reduce drug-related harm. It was found at the end of this initiative that there was a high level of congruence between wastewater analysis and the survey data for methamphetamine, cannabis, and alcohol, and the results had strong statistical significance. It was also possible to measure the impact of law enforcement action and to explain the trends that were being observed in drug markets and consistency between different data sources. Next slide, please. At a strategic level, the ACIC's wastewater program leaves us well placed to monitor the impact of major shocks to drug markets such as COVID-19 or large drug seizures. At an operational level, the graphic in this slide shows a comparison between wastewater analysis of the methamphetamine market in a regional town, and the results in red of a drug survey that was conducted at the same time. The diagram shows that during the period being monitored, drug consumption in the town was impacted in different directions by public holidays and law enforcement action. Public holidays led invariably to increases in meth consumption, and law enforcement action led to decreases in consumption of meth on a short-term basis. Interestingly, there was a close correlation between survey and wastewater results for the 90-day period in question. Next slide, please. In all Australian jurisdictions, the ACIC is able to map drug consumption at individual sites within each of our states to generate increased understanding of local drug markets and also to guide responses by the relevant authorities. This slide also illustrates the variance that exists within a single drug market in different locations within each jurisdiction. So what you're seeing here is a whole series of sampling sites between a state in Australia and the different trends that apply, in this case for methamphetamine, within that particular state. So the wastewater program provides valuable insight into drug consumption in regional locations in particular, with limited data being available from other sources. And this is important because per capita regional consumption of many drugs in Australia can exceed per capita capital city consumption. So this slide in particular shows the dominance of regional sites in relation to the per capita consumption of methamphetamine. It also shows the apparent significant impact of COVID restrictions in mid-2020, but a subsequent recovery from the meth market. In our country, meth is a large and resilient drug market, and organised crime will always find a way to supply the market. This sort of information is regularly used in briefings of police commanders and other response agencies in determining where to allocate resources. So in summary, the ACIC is now routinely merging data sets in developing our analysis of drug markets and assessing the effectiveness of responses, because we understand that holistic problems require holistic solutions. What we know from our National Wastewater Drug Monitoring Program is that differences exist within and between drug markets and across time. This holds true even during catastrophic events. So layering multiple data and intelligence improves understanding and generates new insights and allows for informed and more effective collective responses to drug markets and their harms. The Australian method of implementing wastewater analysis is cost-effective and readily transferable to other countries. Similar programs are in place in Europe, North America, Oceania, and Asia. Amber and I and Ben are happy now to take questions.